As a new mom who recently went through pregnancy and labor, I know all too well how important it is to find support and care during such a vulnerable and overwhelming time. But for so many moms across the country, accessing quality maternity care is an obstacle that adds another layer of challenges to motherhood, especially for those living in what's known as a maternity care desert. These are areas that have limited to no access to a birth center or obstetrics provider. As a result, women and babies in maternity care deserts have an increased risk of poor health outcomes, including death. Yet for all the resources we have in the country, the U.S. continues to have the highest rate of maternal death among high-income countries in the world, and the situation is only becoming more and more dire as more obstetrics units close nationwide. According to a recent report by the March of Dimes, more than 1 in 3 counties in the country are maternity care deserts, leaving more than 2.3 million women of reproductive age without access to critical, life-saving maternity care. But for those living in a maternity care desert, there are certain things you can do to prepare. 1. Get prepared for planned pregnancies. For planned pregnancies, make sure you're as healthy as possible prior to getting pregnant to reduce the risk of complications, which your local hospital might not be able to handle. 2. Establish care ASAP. Less prenatal care can mean more unexpected complications that small hospitals aren't always equipped to handle, so it's important to find and establish care as soon as you can. 3. Use health resources. Several federal and state programs and insurance plans provide services for pregnant women. 4. Ask all the questions. Although providers may be limited, those that are available are dedicated and want you to have a good experience, so don't be afraid to discuss anything that's on your mind. 5. Plan for transportation. Lack of transportation and travel costs are the most common barriers to accessing maternity care. If transportation is an issue for you, work with your OB-GYN to schedule your appointments all the way through your due date. 6. Attend prenatal classes. Prenatal classes can help you prepare for labor and delivery as well as the postpartum period. If there are no in-person class options in your area, you can access several virtually. 7. Use a midwife. If you're low risk and planning on a vaginal delivery, another source of maternity care is using a certified nurse midwife. These are people who are trained to provide reproductive care during pregnancy, labor, and delivery. 8. Find a doula. Doulas are birthing helpers who can advocate for you during labor and delivery when you may not be able to advocate for yourself. Doulas can provide one-on-one emotional support, which is associated with better labor outcomes. 9. Know the signs of emergencies. Educate yourself on the signs and symptoms of preeclampsia, preterm labor, and other potential pregnancy complications. If you're aware of what to look out for, you can get care quicker, especially if that means transporting you to a bigger hospital farther away. 10. Advocate for yourself. Don't be afraid to advocate for yourself and your newborn baby. If something doesn't feel right to you, communicate that to your healthcare provider. The sooner any issue is addressed, the better the outcome may be. And when you're far away from care, time is of the essence.